Hey guys, this is Thomas over here at NurseMoneyTalk, and in this video, what I want to do is I want to talk about being a clinic nurse, like after you graduate from nursing school. That's like being a complete new grad nurse, no nursing experience, and then having clinic nursing be the first job you do. But before I get to that though, I want to go ahead and invite you to hit that subscribe button on this channel. I talk about all things nursing school, nurse life related. And I would really appreciate it if you find this video helpful, that you would consider hitting that thumbs up button, because it really does help me in terms of making sure that more people see this video and find this channel. Let's go ahead and get started to it with, is it a good idea for new grad nurses to start, to have their first job be in a clinic? Now, right out of the gate, I will go ahead and say that I am actually a big fan and a big proponent actually of nurses of new grad nurses getting a job in the field that interests them, but especially in the field and the job that matches up with what their current needs might be, or what their long-term goals might be. Because in my opinion, this notion of saying that everybody should start in hospital nursing, typically specifically med-surg nurses, because you get to hone your skills or whatever the case might be. I think that's overblown, and in a lot of ways I don't generally agree with with kind of like this premise that that med-surg is the only place to hone your skills, because different specialties of nursing will have different skills. And and while there are some skills, for example, in med-surg nursing that will be used across the board, not every skill you learn there will. And so the main thing though, which, kind of to sum all this up, is that I think if clinic nursing fits with what your needs are, with, whether that's what you need for your family or for yourself, or if it's what your long-term goals, then I think you should go right ahead and do it. Because the thing about it is, like, there's a host of reasons why clinic nursing might be ideal for your situation. So for instance, like clinic nursing, they tend to have really nice hours at times that, you might say family friendly hours. So for instance, you're usually working, banking hours, whatever you want to call it. So that's typically like, 7:30 a.m. to like 4 p.m. Different clinics will have some kind of variations of that as well. So it might be 8 to 5 or something of that nature. So, but either way, you're working those hours, which the nice thing about those hours is that, if you have younger kids, those are the hours that are easy to find a daycare for. And if you have older kids, so school age kids, then those hours will match up relatively close to what the school hours are, with possibly, might needing like, an before care or after care as well. But those are things that are easy to kind of to get childcare for, or to find support for, because, if you work like a 12-hour shift or you work like 12-hour shift, on a night shift, then you can imagine finding people or daycare or babysitter or whatever to watch your kids at those odd hours can be very hard. The other thing about clinic nursing is that, on top of the hours, the days tend to be pretty nice too. They tend to be Monday through Friday, like kind of like I already alluded to, typically no holidays, no weekends. Though I will caveat that by saying that some clinics, you might have on-call, especially a rotating on-call schedule if you kind of do like the specialty clinics, so working in endoscopy, as an endoscopy nurse, for instance, you're typically going to have, even though the clinic might run Monday through Friday, for example, a lot of times you'll have rotating calls. So some to keep in mind as well. Some clinics will also, you might have to come in on a Saturday or so. And honestly, the other thing about that is that clinic nursing, for the most part, tends to be less stressful than hospital nursing. Now, I'm not saying that there's no stresses in being a clinic nurse or anything like that, or being a clinic nurse is easy peasy. No, not what I'm saying. I'm just saying that to me, when you compare the worst day as a clinic and the worst day you could have being at a hospital nurse, I think I think hospital is going to be the worst, especially you're going to have a lot more worse days, in my opinion, than you will doing clinic nurse. So, I think like if you are a nurse that's looking for more of a low stress nursing job, I did make some videos on low stress nursing jobs, so I'll put that link up there. But if you are looking for low stress nursing job, clinic nurse is not a bad place to start looking at. Now, I will say that, even though I think starting as a clinic nurse is not a bad place to be at, I will caveat this saying that there are some cons to this option. So there are some cons to what I said. But I think it's important to mention that, you're going to have cons in any options that you pick. So whether you start in hospital nursing, whether you pick, start in clinic, as a clinic nurse, there's a con to both scenarios. The key thing and the key thing that should drive your decision making is that do the benefits, so do the pros of those jobs, does it outweigh the cons for you and for your specific situation? So for instance, as a clinic nurse, the pay may or may not, the pay at times can be not as good as you would get in a hospital nursing. Now, things to keep in mind is that, when you're looking at specialty nursing, especially clinic nursing. So for example, going back to the example of the endoscopy nurse, that might be a little different as well. And also going along with the pay, I think at times you might miss out on like the shift differentials, the opportunities for overtime might not be, working as a clinic nurse myself, I have found that opportunities for overtime and, if you want to pick up extra shifts and stuff, those opportunities just tend to not be there as much as like when you do hospital nursing and your unit is literally open 24/7. So if you want to pick up a lot of shift, those shift differentials make a lot of money. Those opportunities tend to be more readily available on the hospital nursing side. The other thing that I will kind of throw out there as well, which is to kind of say that I do take notice of some of the arguments that some people, that some nurses will say for the reason why you should start in hospital nursing is that, you might have a little bit of a harder time leaving clinic nursing and trying to go to hospital nursing, since a lot of times, those positions, they do want nurses that do have hospital nursing. They want nurses that had acute care nursing, in the sense of like you've dealt with patients with acute symptoms. But but to me, like, that's not to say that it would be impossible to do it. It might be a little tougher, sure, but does that mean that you shouldn't necessarily do it? No, I don't think so. Because I think with the way the demand for nursing is, depending on your area, of course, and there's always kind of like an ebb and flow to that demand, I think you can always branch out and do something else if you really wanted to. And honestly, if you never want to branch out, then what difference does it make, So that's kind of the things that that I think about as well is that when you are making this decision, right? So if you were to ask me like, which one should you do? I would say first think about what your immediate needs are. So what do you need right now? What do you need? What does your family need? What do you need to function? Then you need to think about what are your goals? What are your current goals? What are your, the goals for maybe the couple months down the road? And then what are your then long-term goals? And then use that decision to then guide which one you should do. So for instance, if your goal is to eventually go back and become like a CRNA or something like that, then you know that, okay, I need hospital care nursing, but specifically, you probably need more like the ER nursing, ICU nursing. So that's kind of what I'm talking about, is that just, don't just listen to the naysays. You need to listen to yourself, and you need to realize, where do I want to be at? And then use that to then guide your decision. With that said, if you are looking for nursing jobs, I just want to, throw out a plug there for nursemoneytalk.com/jobs. Check out a job board, see what options are available for jobs that you're looking for. So definitely check that out. Thank you so much for watching this video, and I will catch you very soon in that next one.